So hello everyone, welcome back to another topic of dentistry. Today we will be learning a very basic topic of dentistry which is useful for clinical postings, for departments, for Viva also. Okay, so it is basic terminologies we use in dentistry or dental anatomy. Okay, so let's get started. So the basic terminologies which we use, in that first we will complete this crown and root, then moving toward the surfaces. Okay, so crown and root we will cover this now, surfaces we will tell in further slides. Okay, so crown, this is the portion or the part which we encounter when we check the oral cavity. Okay, so it is a visible portion of tooth. Okay, and root which is embedded in bony socket, so this is root. Okay, so crown and root, they are both connected towards to each other by neck. Okay, which is also the cervical part of the tooth. Okay, then moving to the structures present in crown and the root. So crown consists of enamel, dentin and pulp. Root all consists of cementum, dentin and pulp. Okay, so enamel, first moving toward the crown. Crown consists of enamel, and dentin, enamel, dentin and pulp. Okay, and root consists of cementum, dentin and pulp. So remember, pulp and dentin both are common in a crown and root portion also. Okay, now what is enamel? Enamel, it is the hardest structure which covers whole of the crown surface. This is enamel. Okay, what is dentin? Present beneath, just beneath the enamel, is known as dentin. And what is pulp? It is the innermost portion of a tooth. This is pulp. Okay, now in crown, it was in crown. Okay, now moving towards the root. In roots, okay, in root, cementum. Cementum, what is cementum? Cementum is the portion of a tooth that covers whole of the root surface. This is cementum. Okay, then dentin, as I have told, present just beneath the enamel in crown and cementum in root. Okay, and what is pulp? Pulp is the innermost portion. This is pulp. Okay, so tooth consists of hard and soft tissues. Hard tissues, in hard tissue category, enamel. Okay, enamel, dentin and pulp, they are the hard tissues. Enamel, dentin and cementum, they are hard structures or hard substances of tooth, and pulp is soft tissue. Alveolar bone is also a hard substance. Okay, another point to remember here is what is pulp chamber and what is pulp canal. Pulp chamber, if it is present in crown, it is chamber. If we are looking in root, it is canal. Okay, remember this point. Then moving towards the tooth surfaces. Okay, moving toward the tooth surfaces. Tooth surfaces, basically in any tooth, mostly in posterior, it consists of 5 surfaces. In anterior also it has 5 surfaces. In posterior also it has 5 surfaces. So what are the 5 surfaces of tooth? 5 surfaces of tooth. It is buccal. This is the buccal surface. Okay, this is lingual surface. Okay, this is mesial and this is distal surface. Okay, so how will you differentiate between mesial and distal portion? This is the point. So suppose we have 2 tooth. Suppose they both are central incisors. Okay, they both are central incisors, and we have a midline which divides body into 2 equal halves. Okay, so this is right side and this is left side. Suppose this is right and this is left side. Okay, so how will you tell which is a mesial and which is a distal side? So the portion of a tooth, as body is divided into two equal halves by a midline, same as tooth is also divided into two equal halves by a midline, okay, which is parallel to the tooth surface or parallel to the midline of the body. Okay, now the portion of a tooth which is towards the midline, so this is the portion of a tooth which is towards the midline, is known as, yes, it is known as mesial side of tooth. It is known as mesial side. Okay, and the portion of a tooth which is present away from the midline of a tooth is known as distal side. So this is distal side. Okay, hope you people have understood. Then coming to the facial or the buccal or lingual or the palatal side. So when will you tell the facial or buccal, and when will you tell the lingual or the palatal? For maxilla, remember this point. For maxilla, the surface which we see when examining the oral cavity, first surface which we encounter is labial, okay, because it is towards the lip. So it is labial. And the surface which is towards the palate is known as palatal. So it is for anteriors. Remember this point. Okay. And for posterior, the surface which is present towards the cheek is known as buccal side, and the portion which is present towards the palate is palatal side. So palatal is common in anterior and posterior also. Okay. Next, moving to the mandible. Moving to mandible. For mandible, the surface which we encounter first, the labial surface. For anteriors I am telling the labial surface, okay, which we encounter first is the labial surface, and the portion which is present towards the tongue is the lingual surface, okay. So we denote it as LI for lingual and LA for labial, okay. And for posterior we have same as in maxilla, same as in maxilla. In a posterior for mandible, the surface which is present towards the cheek is known as buccal, and the surface towards the tongue is the lingual portion. Okay, remember this point also. So now it is, I hope it is clear now. Okay, which is labial or buccal, which is lingual or palatal surface. Okay. Okay, just a glance of this. This is facial surface. Facial is nothing but buccal or the labial surface. This is lingual surface. Okay, this is mesial surface, and this is distal surface. Okay, and they and one more surface, which is fifth surface, it is occlusal surface. Okay, it is the very important surface is occlusal surface, because more of the structures are present in occlusal surface only. Okay, so basically it was this tooth which is represented here in a picture is mandibular second molar. Okay, yes, just for telling which tooth it is a mandibular second molar. Okay, next moving to, so this is a margin of a tooth. Okay, margin of a tooth is this. So what is marginal ridge? This elevation. Okay, this elevation is nothing but a marginal ridge. Okay, done. Marginal is also done. Actually, marginal ridge, according to its description, it is a rounded border of enamel which form the mesial and distal margins of occlusal surface of posteriors, like premolars and molars also. Okay, so this is known as a marginal ridge. Then comes the oblique ridge. Oblique ridge present mostly, okay, mostly क्या ये mostly means like it is a feature of upper first molar. Upper first molar. Okay, suppose this is upper first molar, this is palatal surface, okay, mesial surface, distal surface, and this is a buccal surface. Okay, So we have mesiopalatal cusp, distobuccal cusp, okay, mesiobuccal cusp and distopalatal cusp. Okay, so remember it is a feature K upper first molar has a huge or the largest cusp is the mesiopalatal cusp and smallest is distopalatal cusp, but a ridge present or the line or the ridge which connects mesiopalatal from distobuccal is known as oblique ridge. Okay, remember this one. So what is oblique ridge? Oblique ridge is a ridge present on over the occlusal surface of first molar which connects mesiopalatal, okay, mesiopalatal to distobuccal, okay, distobuccal and mesiopalatal cusp, okay. Then moving towards a pit. What is pit? Pit is a depression. It is not elevation. Remember what are the elevations and what are depressions we ask in Viva. Okay. So what is pit? Pit is a small pinpoint depression located at the junction of developmental groove. Okay. Example of is central pit. Look here. This is a central pit. This portion is central pit. What is central pit? It is a pinpoint depression. It is a pinpoint depression which is present at the junction of two cusp or junction of groove. Okay, central pit, and different names we will give according to the locations. But example is a central pit. Okay, then moving to the fossa. Fossa, it is an irregular depression. Remember this. Pit is a small pinpoint depression. Fossa is an irregular depression. Okay, and they are also named according to location like triangular fossa, lingual fossa, central fossa, etc. Okay. Okay. Cingulum present on the lingual surface. Cingulum is the feature of anteriors. It is not present in posteriors. It is a feature of anteriors. Okay. Suppose I am drawing here a canine. Suppose this is the upper canine. Okay. And we have an elevation like cusp on posterior. It is a cusp like structure on the lingual surface of anteriors. Okay. Known as cingulum. Prominent feature of anterior is cingulum. Okay. And it is more prominent on canine. And then moving to what is sulcus. Sulcus is a long depression or a valley on the surface of tooth between the ridges and cusp. Okay. So this is the cusp. This is ridge. Sulcus is this portion is known as sulcus. Okay. Then moving to the next, divisions. For better understanding of a particular teeth, we divide tooth portion into thirds. Okay, so it is division into thirds. This is, as you can see, this is anterior. Suppose this is, yes, suppose it is central incisors. We divide the tooth into three equal halves from any aspect. Every aspect of the tooth we divide it into thirds, whether it is labial, proximal, or lingual, or occlusal, mesiodistal, or labiolingual, buccopalatal. Any surface we divide the tooth into thirds. So what are the thirds? As I have told what is mesial and distal. Okay, and middle, you know what is middle. Okay, so labial surface aspect, from the labial aspect, the tooth, how it is divided into thirds. The mesial toward the midline, distal away from the midline, and the middle portion is middle third. Okay, and same in proximal aspect. Proximal is nothing but mesial or the distal. Okay, labial surface which is present towards the lips, okay, lingual towards the palate or the tongue, and middle portion which is middle, present middle, okay. And buccal aspect of posteriors, same as buccal, middle and the lingual. And then proximal aspect, occlusal, remember occlusal, middle and cervical, okay. Cervical, as I have told, neck is also known as cervix of a tooth, so this is cervical, okay. And same as root also, cervical, middle and apical, okay. Apical towards the apex, okay. The end portion of a root is known as apex, okay. Yes, so it is about the thirds. Next, so yeah, that's it for this topic of basic terminologies of tooth, which are very important to know any anatomy of a tooth, or for communication regarding a tooth or a treatment plan, or any like discussions on a tooth, okay, or carvings, okay. So hope you people have understood this topic. If you did, just share this topic with your fellows, and if you have understood anything from this topic, just like and subscribe to this channel, okay, for such further videos, okay. Thank you.